evening, colleagues. Good evening, my friends. How are you? How is the evening? Today is 21st of December 2023, and we are coming to the end of 2023, beginning 2024. So welcome to my live today, and again, today I'm only going to be answering questions. So just set your questions straight, and I answer you. And like I've always said, I only deal with questions of reproductive health, things to do with getting pregnant, things to do with women problems, things to do with men failing to make someone pregnant, and that. So that is all I am dealing with, and I'm expecting your questions today. So straight away, let's go to, I welcome you to my live today on both YouTube and TikTok. So straight away, let me start with these questions. Number one, Kechi Gaviro Morin is saying, been waiting for this. All right, so we're already live. Precious Musunga is saying, I start my period on 4 December. When is my ovulation? Now, Precious, we can't tell you your ovulation day if we don't know the length of your menstrual cycle. So kindly tell us the length of your menstrual cycle. When we know the length of your menstrual cycle, we can be able to tell you your ovulation day. That is simple. It's simple for us. We shall catch it for you as long as you give us the length of your menstrual cycle. So kindly let us know the length of your menstrual cycle. We shall answer you right. This one is saying, Jennifer Giluwick is saying, I have a question. I can get pregnant on ovulation day? Yes, you can get pregnant on ovulation. Actually, on the ovulation day is the day you have almost 100% chances, around over 90% chances of conceiving. So people targeting to get pregnant need to target the ovulation day. The ovulation day is the day when someone is really in a good position to conceive. So ovulation day, yes, you can get pregnant on your ovulation day. All right, this one is saying, Caroline O1 is saying, when can I get pregnant? Should I get pregnant after when should I get pregnant after miscarriage? I've always said it that when you get a miscarriage, the number one thing is to find out what caused that miscarriage. Before you think of of conceiving again, first find out what caused the miscarriage. When you know, or maybe you may fail to really find out what caused the miscarriage, we always advise that at least first wait for one menstrual cycle, one normal menstrual cycle. Just allow one menstrual cycle or just one month of menses. In other words, if you see your periods again, then you can allow to conceive again. But if you've not yet seen periods, it is not advisable for you to conceive. Why? Because you may confuse these things. You may get another miscarriage on the way, but it may also, because remember, you've just had a miscarriage, okay? And during the miscarriage, of course, you bled. You had bleeding. Now, if you conceive again and get another miscarriage, that bleeding will happen. It will be very hard for you, even for the doctors, to confirm or to distinguish whether this bleeding is as a result of a new miscarriage or it's as a result, it's a complication of the other miscarriage that happened. So we usually encourage that you first at least allow one menstrual cycle and then you conceive. So that's the answer I will give you, is that first allow at least one menstrual cycle. Then another question is from Shamira Kantengwa, is saying, hello doctor, I am struggling to get pregnant. So sorry about that, struggling to get pregnant. These are things I really don't want to see. Many women suffer, struggling to get pregnant. It's really discouraging. And you know, most times when a woman fails to get pregnant, they receive a lot of blames. People blame them, especially family members, and mostly the family members from the husband's side. They usually want to blame this woman for failing to get pregnant. So it's sorry for you, Shamira, but let's see what we can do for you. I'm struggling to get pregnant, but for these days, 2 months, I have been having abnormal menstruation with too much bleeding, with heavy clothes. I have done vaginal ultrasound scan. So what is your question? Please ask your question very well. So you're struggling to get pregnant. Ask the question clearly. We shall help. Nampala Damal is saying, good evening, doctor. Okay, Nampala Damal, your question is running away. Your question is running away. Your question is running away. Where is the question? Nampala Damal, good evening, doctor. After unblocking tubes, it takes how long to conceive? Actually, it takes immediately. It takes immediately because usually we unblock the tubes when you're nearing your fertile days. And actually, when we are unblocking tubes, we target those days when follicular development has already happened and we are now planning for ovulation. That's when we unblock the tubes. So you're supposed to conceive as soon as immediately after unblocking the tubes. This one is Ruwaida Run is saying, hello doctor, how is Ovaplus tab? My period is 36 days and before couple of months it was 28. Is it normal with this saline chain? No, it is not normal. First of all, 36 days are not normal menses. They are not normal. 36 days is not a normal menstrual cycle. I have always told you that a normal menstrual cycle is between 21 to 35 days. So if it goes beyond 35 days, it means it's not normal and therefore you must investigate. You must do tests. So what I advise, yes, we're talking about these tablets. All these ones, you're not supposed to take them before you test. First find out if the hormone contained in this tablet is the exact hormone you need as a supplement. And therefore, I would advise you to carry out tests. And one of the tests you do is a fertility hormonal assay. Full profile. Do a full profile fertility hormonal assay. Find out what is causing these abnormal periods and then get treatment. You get treated and get very, very fine. Susan Natamba is saying, is it normal to menstruate twice a month? And what could be the reasons? You see, why I always avoid to answer this is because most of you don't know what they call menstruating twice a month. Some of you think, like, if you had menses on 1st of December, then you menstruate again on 28th of December. Some of you think it is abnormal. That is not abnormal. What we call abnormal is when you get menses before 21 days. When you get menses before 21 days, that's what we call bleeding in between menses. But menses after 21 days is not abnormal. And therefore, most of you call it like I menstruated twice in a month. That twice in a month may mean that, like I've given an example, that you had menses on 1st or 2nd of December, and then menses again on 30th of December. That is normal. But menstruating before 21 days pass is abnormal. Amina Nakate, hi doc. It's been long, but doc, my period, all right, it's long. Yeah, Nakate, I know, I remember you were a very a good follower of mine. Okay, Nakate, I remember you. Hi doc, it's been a long time, but doc, my period length was 30 when I was in Uganda. Then 28 last year I was in Nairobi, and now 26 currently in Saudi Arabia. Doctor, am I normal, and what could be the cause? I've already said that there are several causes of alterations in your menses, and sometimes it can be as a result of environmental changes. So the environmental changes can bring about that, okay? So that shouldn't worry you. But first, stabilize in the place where you are. Give it a period of at least 3 to 6 months. If the periods are again not stable, then we can go on and investigate. But other than that, we can take it to be. I have irregular menstruation, but I have been looking for the fruits of the womb. I also have polycystic ovarian syndrome. Please, how do I deal with this? This can disturb. I agree. This can disturb. Now, you have irregular periods and you have polycystic ovarian syndrome. What is causing the irregular periods is, of course, the polycystic ovarian syndrome. Now, what you're supposed to do is to first treat the polycystic ovarian syndrome. Before treating polycystic ovarian syndrome, do a fertility hormonal assay to also look at the level of your fertility hormones. Now, with polycystic ovarian syndrome, you're going to use medicines. Now, depending on the tests you have done, including blood sugar levels, you may use a drug like metformin, okay? Then you also couple it with drugs containing inositol. Drugs like Rimona, PCOS, and so on can be used for treating polycystic ovarian syndrome. So when you start this medicine for polycystic ovarian syndrome, that's when you also involve fertility drugs, the likes of letrozole. The ovulation date will be able to conceive enam. Lydia is saying, I tested. Okay, where is it shown? Lydia is saying, I tested ovulation, but it was not clear. What are the causes? Causes of what? Causes of unclear ovulation? Please state your question very well. Janet Telmiha is saying, please, want to know the best way to get pregnant with twins. I started my period on period 9th December and the 31st December 2023. When is the right time to conceive? Now, the right time to conceive, if you look, we look at, we are assuming, I'm going to assume, I'm going to assume that this is regular, okay? I'm going to assume that this is regular. So if you had periods on, 9th of December, and then you saw periods again on, we can't calculate for you because you're only giving us the period when the day when you ended your periods. Give us the day you saw periods again because we want to first to calculate for you. I think we can't help you with this, okay? We can't help you. We need, Janet, you need to tell us when, because you've told us when you saw your periods, now tell us when you saw the periods again so that we can know the length of your menstrual cycle and calculate for you the ovulation date. But for conceiving twins, we advise you take gonadotropins, medicines that cause hyperproliferation of the ova and cause hyper-ovarian stimulation, okay? So those medicines include letrozole, clomiphene, tamoxifen, and medicines that fall under that. Those are the medicines that can be used for someone to get twins. Okay, then we have another question. Elizabeth Feber, Doc, what can I do to reduce the pain I get on my ovulation day because I can't have sex with the pain? Use painkillers, okay? Use pain medications, use NSAIDs. Okay, so those of you on YouTube, try to increase the volume of your phones and your gadgets you're having. I'm having a problem with the audio, and I think that's why you're not getting me well. So try to increase the volume on your gadgets. Okay, those of you on YouTube, let's first give it seconds as we organize our audio. We are organizing our audio. In a second, we are going to be back. Sometimes ovulation can take up to 24 hours, so it's okay, you can meet them. And we've seen some people ovulating almost for 48 hours, for 48 hours, so it's okay. Okay, so those of you on YouTube, we are back. I hope you're getting me live. It's not on. Video not on. Video not on. Sometimes ovulation can take up to... Okay, so I think my audio is now very, very fine. So comment if my audio is fine. I need to know so that we can really continue. Thank you so much. All right, let me go to the questions. If no periods, then ovulation date. Of course, you can't know your periods. And it is unlikely that you'll have ovulation when there are no periods, okay? It is very unlikely. Seberu, who was asked, I think it's Aisha Shah, it's unlikely that you'll have ovulation when there are no periods, okay? So it's very, very unlikely. And therefore, what you're supposed to do is to first make sure that you bring your periods back. And I think I've already talked about how you can bring your periods back. So you need to first look at how you bring your periods back. Then when your periods are back, you can now think about ovulation. This one, Elizabeth Favor, you wanted to know the medicines you can use to reduce pain during ovulation because you can't have sex during that ovulation in day. Use NSAIDs, medicines like mefenamic acid, even Panadol or paracetamols of this world can be used. You can use tranexamic acid, you can use medicines like ibuprofen, diclofenac, all those medicines can be used to reduce the pain. And if the pain persists and is really too much, you can go to the hospital and start medicines, higher level medicines like tramadol and those even injections to reduce that pain. So it is possible to manage the pain. Is it normal, Charita Waheza, is it normal to have pains after MVA? MVA, MVA is a procedure we use to remove the products of conception. Like if you are pregnant and maybe you had a miscarriage and there are some clots that have remained or some parts of the fetus that have remained in the uterus, we do an MVA to remove everything. Yes, it is possible to have some pain because remember, this procedure is irritative. So some people get pain, but it shouldn't go beyond 24 hours. Therefore, we expect pain after MVA, but it shouldn't go beyond it shouldn't go beyond 25. It shouldn't go beyond 24 hours. If it goes beyond 24 hours, then there is a big problem. Okay, so we have Auma Bena is saying, good evening, doctor. I have pain in the vagina. Okay, I have pain in the vagina and burning. What do I do? Now, that is likely to be a sexually transmitted infection, an STI, and you are supposed to go very fast and treat it. The first thing I will tell you is to do a high vaginal swab, HVS. Go to the hospital, do a high vaginal swab. But after that, you will get the medications. But with that, if there is pain and it's burning, most likely that is vaginal candidiasis. So what I advise you, you can take pessaries. So what I advise is that you can take pessaries, okay? You can take antifungals because that is likely to be a vaginal candidiasis. Like I've said, you can take antifungal drugs. You can take drugs like fluconazole. You can take drugs like pessaries, like gynozo pessaries, nystatin pessaries, clotrimazole pessaries. All those medicines can be used. But before you take those medicines, I would advise you to first go to the hospital and do an HVS or a high vaginal swab. Janet, tell me, doctor, are there any diet or foods to eat or exercise when planning to get pregnant? Yes, I think, Janet, tell me now. Check in one of my videos. In one of my videos, I talked about foods and supplements, vitamin supplements someone can use when they are preparing to get pregnant, and those vitamins or vitamins that can help to make someone's reproductive system healthy for you to conceive. Check in one of my videos, check those videos. One of them is talking about that, and it is very self-explanatory. You'll get those answers right. Doctor, please, I am having high temperature. I don't know why. Having high temperature, you may be having malaria. You may be having typhoid. You may be having bloodstream infections and many other diseases. Go to the hospital, do a blood test, do blood tests, you'll identify what is happening. But think of malaria, think of typhoid, think of bacterial bloodstream infections and any other diseases. That is likely to be what you're having. Lydia, I took Clomid for 5 days after my period, but I am ovulating. So what's the question? You took Clomid after 5 days, but even before I get to know what you're asking, this is wrong. Taking Clomid after 5 days, what are you targeting? Taking Clomid after 5 days, what's the length of your menstrual cycle? This is likely to be a mistake. I don't know who advised you to take Clomid after 5 days after your menstruation. It will not work. That is not how Clomid is taken. And you've already seen the explanations I've given. We take Clomid depending on the length of your menstrual cycle. And we don't look at when you've stopped periods. We only look at when you've started periods, when we are giving you Clomid. So mind about that. Precious Musunga is saying, I started my period on day 4 and ended on 10. When is my ovulation? We cannot know your ovulation day when we don't know the length of your menstrual cycle. Tell us, Precious Musunga, tell us the length of your menstrual cycle. We shall be able to calculate for you the ovulation day. Mercy, good evening to you. Auma, who? This one is, the question has run away and someone will say, I didn't answer. Okay, it's gone. It's gone. I'm sorry, you'll ask again. Okay. Ilhan Adan is saying, I missed my period for 2 months and yet I'm not pregnant. Please advise me on that. Now, if you've missed periods for 2 months and you're not pregnant, you are likely to be having two things. Number one, either you have fibroids or you have hormonal imbalance, and that is likely to be low levels of progesterone, what we call hyperprogesteronemia. When you have low levels of progesterone, you're likely not to have your periods. When you have high levels of prolactin, you're likely not to have your periods. So it's either hyperprolactinemia, that is high levels of prolactin, or hypoprogesteronemia, which is low levels of progesterone hormone. So what I would advise is for you to carry out fertility hormonal assay and also do a pelvic ultrasound scan to confirm that you don't have fibroids, no any masses in your uterus, and also do a fertility hormonal assay to look at the levels of your fertility hormones. Okay. This one is saying, Tracy Mwenda, hello, Dr. Hello. Eggibone Johnson, I am 5 weeks pregnant. What are the things to eat and avoid? A person who is pregnant, I tell you to eat each and everything you feel like except alcohol and smoking. Avoid alcohol, avoid smoking. Those are the things I can tell you to avoid, but other things eat. Make sure that you're eating vitamins, good vitamins, eat greens, okay? Eat foods rich in proteins, and so on. Okay. Okay, I think this time around we are going to get rid of, we are going to be getting off TikTok, and then we shall be continuing with WhatsApp. Let me answer one question from TikTok. One question. Van Silla 1 is saying, hi doc, please, I just had my first 4 days menses, okay? After my mectomy, do I consider it as my first cycle? Yes, you consider it as your first menstrual cycle. Yes, I say yes. So for those of you on TikTok, thank you so much for watching, and now we are continuing with YouTube. Thank you so much and have a lovely day. Thank you. God bless you. We are now continuing with those people on YouTube. Find us on YouTube. The name is Ask Dr. UTHUMAN. Go to YouTube and ask your questions from there. We still have a little over like 30 minutes on YouTube. Thank you. Goodbye for TikTok. Okay, so we are continuing with you people on YouTube. Someone is saying, Okay, where is the question? How long can one take on folic acid tabs 5 milligrams to conceive? Folic acid does not make people conceive. Tracy Mwende, find out what is causing the problem, okay? Folic acid will not make you conceive. Folic acid provides just the general reproductive health status. It maintains your a healthy reproductive status, but it won't make someone conceive. It's just a simple supplement. When you have a problem, when you have a disease that is making you not conceive, you will still not conceive even when you're taking folic acid. Okay, Jemima Telima is saying, my period came on 9th November and it came on 9th December. Okay, 9th November and 9th December 2023. Please confirm when to conceive. Thanks. All right, let's calculate for you. If your periods came on 9th of November, then again on 9th of December, 9th December. Let's calculate for you. So we have 9. So we have 9, 9th of November, 10th, 11th, we are going to calculate for you. 9th, 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th, 19th, 20th, 21st, 22nd, 23rd, 24th, 5th, 6th, 7th, 8th, 9th, 20th, 30. November is 30 days, okay? So we start 1st December, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, blah, blah, blah. That is December. So we count. You started from here. This is day 1. Okay? 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We said a day before. So this means you have a 30-day cycle. All right. So if you have a 30-day cycle, we are calculating the ovulation. They want to find out when this lady can conceive. So if we've gotten to know the length of a menstrual cycle, which is 30 days, now 30 days, your cycle, the length is 30 days. So if we want to find out your ovulation day, we shall say 30 minus 18. What's the answer? Someone give me the answer. 30 minus 18. Which answer do we get? 30 minus 18. Which answer do we get? I want to see those of you having the answer. Okay. We are having the answer here. Okay, yes, Hey, someone is saying 12, another one 13. What's the answer? What's the answer? 12. All right, so the answer is 12. 30 minus 18, it's 12. Thank you so much. Now, what are we supposed to add? Those of you who have been following me, what are we now supposed to say? We are supposed to say 12 plus what? We want to get her ovulation day. Thank you, Jennifer Gigi. This person follows me is already having the answer. That means 12 plus 4, which is 16. Now, your ovulation day is on the 16th day of your menstrual cycle. So, 16th day is your ovulation day. So, we shall still get 16 plus 5, which is 21. So, therefore, you are fertile from day 12 up to day 21. But your ovulation day is on the 16th day. That is your ovulation. I think that is very, very clear, and we end it at that. I hope you've gotten the answer. You now know when you can meet your spouse in order for you to conceive. I think that one is very, very clear. Let me have another question. That is from that was from who gave us that question? Okay. I want to go back to the question. Okay. Okay. All right. From Janet Terimina. Yes. Now we have Chavita. We have Chavita Joan. Hi, Doc. Can folic acid help to get pregnant? You see, folic acid is just a supplement. It won't make someone get pregnant if they have a problem. For example, if you have a problem with your hormones, you have to treat your hormones, your hormonal imbalance. If you have if you have masses, if your tubes are blocked, folic acid is not going to make you pregnant. I repeat it quite often that folic acid will not make you pregnant. You have to treat the cause of your infertility. Auma Bena, doctor, I have tried everything. It's now 5 years. Can you help me with your WhatsApp number? I send you some of the reports. You help me, doctor. Auma Bena, I don't give out my WhatsApp number. If I give it out really, and I will be every day, like the whole day I will be answering people because I have many of you. But if you would like to be helped, go and book an appointment on my website. It's put for them the website. The website is www.druthman.com. Go there, book an appointment, then they will be scheduling you and you talk to me. So what I can say is you go to the website, they are going to put for you the website there. You log in. You book the appointment, then I'll be able to answer your questions. But the WhatsApp, really, we shall not be able to get in touch because you guys are many, and I cannot answer everyone on WhatsApp. Otherwise, I will not be doing activities at the hospital. We have Rosie Natwe saying, yes, the sound is clear. All right, okay. Auma Bena, how do I get you, doctor? I've told you, go to the website and book an appointment. They are going to put for you the website there, but it is www.druthman.com. Aisha, I went for injector after miscarriage of 22 weeks. Before I meet my man after 3 months. I had a heavy bleeding. Does it mean that I was pregnant? It is not easy to know whether you are pregnant or the bleeding is as a result of something else. If at that time, if you had performed a pregnancy test, okay? Because I have already said that even when you bleed today, when you're pregnant and you bleed, and still you do a pregnancy test, it will still show you positive, okay? The pregnancy test becomes negative after a period of 28 to 40 days. That's when it becomes negative. Ernest Opong is saying, my girlfriend had her periods on 22nd November and had it again on 19th of this month, but she's complaining of not having a good flow. So a good flow, what do you mean by not having a good flow? Ernest Opong, please clarify. What do you mean by not having a good flow? Let us know what you're meaning. Namitala Sharifa is saying, hi, members. All right. Raymond Esiedu, can a woman get pregnant? Can a woman pregnant for 24 months and the baby survived? What do you mean? I don't understand your question. Ask it again. Janet Telimina, is there any danger in conceiving when a fibroid is of size 3 millimeters out of your woman? Now, if you have a fibroid and you happen to conceive, it is okay. There is no problem. But that pregnancy is a precious one, and it's supposed to be followed up, okay? So that is a pregnancy which is supposed to be managed from the hospital. Make sure that you have proper antenatal visits at the hospital so that it can be managed very well. So there is no problem of conceiving, but it should be managed very well. Gina Atta is saying it goes up, prolactin. I take Paraldel, then it comes down, but then after some time it goes up. Yes, prolactin, actually one of the most difficult things to treat is high levels of prolactin. You give it a medicine, it goes up. You stop medication, it goes down. So what are you supposed to do? Continue taking medications and plan conceiving very well. Because when you conceive, of course, things will be fine. Okay. So plan on take the medications, streamline or stabilize your prolactin, conceive. Don't mind about it going down as long as you've conceived. Jenny Bless is saying, hi doc, how can I know I am ovulating? Previously I was getting clear mucus, lately I don't get. Now there are very many other signs of ovulation. Signs like lower abdominal pain, engorgement of the breasts, and some mild pain mild pain in your breasts. Also, during that day, put for them the website. During that day for ovulation, you'll be able to feel like you want to have sex, okay? You'll have that urge to have sex. In other words, during the day of the during the period of the month, that day you really feel you want to have sex. Almost every time is your ovulation day. So signs are those ones. You feel the urge to have sex, you have breast engorgement and also breast tenderness, some pains in the breast, some lower abdominal pain, and some increase in the vaginal temperature. Then Namital Sharifa is saying, hi doc, thanks for teaching, welcome. Jennifer Gigi is saying, hi, if I ovulate tomorrow and I meet my partner tonight, can I be able to get pregnant? Yes. A day before ovulation and even a day after ovulation, those days you can conceive, okay? Those are days you can conceive. So remember, a day before ovulation is a fertile day. Remember, we've said you count almost like 4 days before, 5 days before. So you can conceive, yes, and yes. Mercy. Please, doctor, when a man cannot get a woman pregnant, what are the causes? In most cases, the problem is with the sperms. Sometimes these people, if someone has erectile dysfunction, the person cannot erect. I think that is understandable. But some are able to erect. They even go 90 minutes and even go ask for extra time, but they are only firing rubber bullets. The sperms they are having cannot make a woman conceive because they are using, rubber bullets don't kill, okay? Maybe, okay? It can land on a softy pattern, maybe. But those rubber bullets cannot make a woman pregnant. Therefore, these people have a problem with their sperms. Either they have no sperm count, or they have dead sperms, or the sperms don't have a good vitality. They are not live. They have their sperms with big heads, and those sperms with big heads cannot make a woman conceive. So, in other words, usually the problem is from the sperms. Poor quality and quantity of your sperms may fail to make a woman pregnant. I think that is clear. Simonia Melis, I have my period on November 30th. When do I ovulate? Tell us the length of your menstrual cycle. If we know the length of your menstrual cycle, we shall tell you when to ovulate. If you just tell us the day you saw periods, that's not enough. We need the day you saw periods, the length of the menstrual cycle. We shall calculate for you clearly your ovulation day. Suraya Nasibova is saying, is it true that a pregnant woman should sit or act properly so that the baby wouldn't get hurt? No, that is not true. That is not true. We even encourage a pregnant woman to do exercises. So this is not true. Suraya Nabewa is saying, please answer. I have answered you. All right. Kiyama's Hub is saying, what about well man and well woman drug? Can it help infertility? Let me tell you, Kiyama's Hub, I discourage so much those so-called fertility drugs when we don't know what we are treating. I encourage people to first run tests first, because before you take this medicine, what is if we asked you what is making you fail to conceive, can you answer? If you're not able to answer what is making you fail to conceive, you don't need to take these medicines you're talking about. Let us first solve the equation. What is stopping this woman from conceiving? Is it fibroids? Is it blocked tubes? Is it the infections that you're having? Is it a problem with hormonal imbalance? Is the problem with your man that is not having proper sperms? What is the problem? Or maybe you are having inadequate sex. So we need to first of all identify what is causing this havoc. When we know what causes this, we can now get medicines. I don't encourage taking these drugs unless we know the cause of infertility. Gina Atta, is there any test you can do to check whether your eggs have matured? Yes, the tests are there. You can do a transvaginal ultrasound scan. It can really look at the vigor of your eggs. Yes, it can. They are there. Kechi Gabiro Morin, trying to get pregnant but in vain. Did TSH, it was 4.6, prolactin 19, estradiol, thickness, any chances of getting pregnant? Yes, you see, Kechi Gabiro, you're doing things in isolation. We need a full fertility hormonal assay. This is not a full fertility hormonal assay. And also the other tests, we need to look at your tubes. Are your tubes normal? You need to tell us. Are your tubes normal? Are the tubes patent? How is your the ultrasound scan? No fibroid, nothing. So then also the fertility hormone, you're only giving us 2 to 3 hormones. This is not enough. And again, when you're giving us these results of the hormonal assay, you're supposed to give us the reference ranges, because different laboratories have different reference ranges. So when you give me 4.7, I may not know whether it's normal, because different machines are calibrated differently, and therefore I'm supposed to know the reference ranges of that machine which was used to test your hormones. All right. Dixon Philly, good evening, doctor. I have been trying to get pregnant for the past 3 years. I was on medication to improve my ovulation and I was able to see the mucus for the past 3 cycles, but still not getting pregnant. Dixon Philly, I want to ask you, is your problem follicle-stimulating hormone and LH? Is it the only problem? If it is the only problem, then you'll conceive. When you see the mucus, you'll conceive. Trust me, you'll conceive. But if there are other problems, then you won't be able to conceive. So let me hope that the problem is only with ovulation and the other things are okay. If you're not sure, then run tests to confirm or to find out what's up with the other areas. And saying, doctor, please, I couldn't hear you. You said concerning my question because of internet hitches. The question is, what do I do as I have irregular menstruation and polycystic? I have said that with polycystic ovarian syndrome, before you treat, do a fertility hormonal assay and also do a blood sugar level. Now, when you're treating polycystic ovarian syndrome, you will take medicines, hypoglycemics, okay, like metformin, okay? You'll take drugs like metformin and then combine the drugs with inositol, okay? Drugs that treat directly polycystic ovarian syndrome, inositol. Those drugs include the likes of PCOS and the likes of Hormonal and so on, etc. So take those drugs, treat subsidize the polycystic ovarian syndrome. As you're taking these drugs, then you also need to take the fertility drugs. Take drugs that do hyperstimulation of the ovary, so that you have your eggs, the good ova ready for fertilization. Then you take those fertility drugs, count your ovulation days, have sex on your ovulation day, you'll conceive. I think that is also very, very loud and clear. Anna Alice, hello doctor, what can I do to help me in labor at 37 weeks? Oh wow, congratulations. At 37 weeks, just relax, go and check with your midwife or your gynecologist, plan the pregnancy, plan the labor very well, just relax. You don't need anything else, relax, but don't forget sex. Sex is very good when you're nearing labor. Sex is very good, and it should be unprotected sexual intercourse, because those semens are very nice. They cause, they stimulate a hormone called relaxin. They stimulate a hormone called relaxin. So sex is very, very important. Nice sex. And when we talk about sex when you're approaching labor, we don't talk about rough sex. Some of it, hey, what am I talking about? But you just need to have some good sex. You'll be able to have a good labor. That's what I can advise. The rest, you can go to your gyne, you can go to your midwife and prepare you for labor. Okay. Another question. Vita Joan, doctor, what is the best medicine for blocked tubes? What is the best medicine for blocked tubes? Now, there is no medicine to be swallowed or any medicine injection for treating blocked tubes. Blocked tubes are unblocked physically, either using surgery or that is all using laparoscopy, or you can use these other non-invasive methods like recannulation or canalization and tubal flushing. Those are the known methods that can unblock tubes. No medicine, no injection that can unblock tubes. Those are myths. People are just lying to you that they are medicines for blocked tubes, but they are not there. Okay, then Honest Opong, I mean she the first 2 days after flow was normal, but on the third day it was little. It is, by the way, as long as, you see, I've already said that the normal flow is between 2 to 7 days. As long as she has had 2 days of normal flow, that is okay. If there is only spotting with these other days, it is still fine. It is very fine. That is normal. That is a normal. Those are normal days. Gina Atta, can you ovulate but not able to conceive? How do I know your eggs are matured enough? I've already talked about how you know, but you can ovulate and fail to conceive. Yes, it is very possible, because there are many other things that can make you fail to conceive. For example, if the tubes are blocked, even if you ovulate like nothing, you will not be able to conceive. Even if you ovulate and your tubes are not fine, okay? If you have fibroids, you'll not be able to, some people will not be able to conceive. So there are many other causes of infertility other than ovulation. Okay, we are left with just 4 minutes. And therefore, I'm doing a few questions and then we shall do next week. But let me answer this other question. Angela Muli, hello doctor, is there any disadvantage of taking P2 on an empty stomach? Please advise. No. There is no disadvantage, but it is better to first eat. Okay? Yeah, sometimes it's better to first take something before you take those medicines, but there is no problem with P2, and I know you're meaning emergency drugs. Raymond Aseyidu, pregnancy can last for 24 months and deliver a baby. Any scientific proof of that? Yes. Oh, this is the question you're asking. In other words, if you had a premature at 24 weeks, 24 weeks in a good setting, that baby can survive. Let me give you my story. When I was doing my internship, we delivered a baby at 24 weeks and 2 days. And it was not even in a good setting. This was a poor facility. The hospital was really not that a good hospital. But we managed to put this baby together. We delivered the baby 24 weeks and 2 days. We put the baby in the warmers. Our neonatal unit was a little bit fairly equipped, but we managed to grow this baby from there. And by I think the baby was around was 600 grams. That is 0.6 kilograms, but the baby survived. So it is very possible, especially in a good resource setting, okay? In a good resource setting. In poor source settings, it's up to 28 weeks. But you can try. I've always told my colleagues that even when you're in a poor setting, at 24 weeks, try to warm the baby, to put the baby in good warmers, do any tube, feed the baby very well. The baby can survive. There's a clear protocol about premature feeding them and so on. Babies can survive. So I've seen a baby of 24 days, personally working on that baby when I was still a junior doctor as an intern, 24 weeks and 2 days, and the baby survived. So it is very possible for a baby to survive at 24 weeks, especially when there is a good care and in a good resource setting. Okay, then Kathe Mbaba's Dr. Nkwagadde, nange Nkwagadde. Anna Alice, okay, all right. Lydia, can I take M2 tone tablets to conceive? No. You see, those M2 tone tablets, they are not. They don't make someone conceive. You see, Lydia, you have a problem, and this problem needs to be solved. I don't know how I can help you, but what I can tell you is that you need to do tests to confirm what is happening. Okay, to confirm what is happening. Let you do investigations, find out what is causing this infertility you're dealing with, and then take clear medicines. Okay, Namitala Sharifa, hi doc, my menstrual cycle is 40. What I want to conceive, so on which day did I ovulate this month? My period starts on 5th and end on 7th. Namitara Sharifa, if the length of your menstrual cycle is 40 days, that is abnormal, and therefore you cannot use it to calculate your ovulation day. The length of your cycle is abnormal. What I advise you is to first stabilize your cycle. I have said that this normal cycle is between 21 to 35 days. Yours is 40 days. It means it is abnormally high. Therefore, you are supposed to first treat yourself. Identify what is causing this abnormal cycle, treat it, and then you can now look at calculating your ovulation day. That's what I can tell you. Doctor, please, she has a 27-day long period, but sometimes it delays 2 days. What could be the cause? All right, those are hormonal fluctuations. Yes, they are hormonal fluctuations, and that is an irregular menstrual cycle, but hormonal fluctuations. Okay. Raymond said, Doctor, 24 weeks, but rather 24 months. Pregnancy of 24 months, which pregnancy is that? Is that an elephant? No. Someone cannot have a 24-month pregnancy. Me, I'm talking about 24 weeks. A normal pregnancy cannot go beyond, you're talking about 24 months. No. It shouldn't go beyond 9 months. Even when it goes to 9 months, it can just surpass by 2 weeks. So 24 months, I won't talk about that pregnancy. That is abnormal, and I don't think that is a baby. I don't think that is a pregnancy. 24 months. Whoa. 24 months, no. A pregnancy can't go up to 24 months, Raymond. Gift Fanga, hi doc, can I conceive while breastfeeding? Yes. Very possible. Very possible. It is very possible for someone to conceive while breastfeeding. Very many people have conceived while breastfeeding. And there are very many people that have conceived when they have not yet seen periods after conceiving, after giving birth. Someone gives birth and they have not yet even seen their periods again, and they conceive. That is very, very possible. Okay. Then Sahara L. Hello doc, everyone, I am late from USA. So what has caused you coming late, Sahara? Okay, so say hi to those people in US. By the way, which state are you, Sahara? Which state in the USA are you? Lydia is saying, please, my period length is 28. I had my period on 5th December. I took Clomid on 9th December. Tested ovulation, but it was not positive. Now, let us look. If the length of your menstrual cycle is 28 days, you are supposed to start Clomid on the 3rd day of your menstrual cycle. Okay? So if you started the period on 5th and started Clomid on December 9th, you took it on a wrong date. Okay? Because those are almost 5 days. Okay? Yeah, but the ovulation was not positive. What we need to first find out whether you have normal LH and FSH. But even you took periods on a wrong date, take them on the 3rd day if you have a 28 days cycle. I think we are now winding up. We are winding up. We are left with, I think, 2 minutes. Yes, 2 minutes. We are left with 2 minutes to conclude our session today. And I am now answering this. I think it will be the last question. Kathy Mbabazi, me, I'm in Massachusetts. All right, say hi to those people in Massachusetts. Doctor, we need your number. I'm sorry, I don't give out my number. If I give you my number on today, I will be receiving calls day and night. I will not be able to work on my patients on ward. So I can't give out my number, but if you want me, go to my website. It is www.druthman.com and book, then we can have a private chat. And by the way, there is we opened membership here. So if you want to become a member, you can join and become a member of Ask Dr. Uthman. There are a few coins you pay and then become a member of Ask Dr. Uthman. And also, please, if you're watching this live, if you're watching our channel for the very first time, do not forget to subscribe. Please subscribe and press the notification bell to be notified of any important videos. And if you're watching this live, and maybe if I've not answered your question today, or if you still have a question and you've not asked it, go to the channel. There are many videos. Those videos are talking about most of the topics. Actually, most of the questions I answer here, I've already talked about them. I've already answered them in the videos. So check out on our videos, check out on our shorts, and share those videos with your friends so that they can also get the information. And by the way, those of you having problems with technology, information technology, you have a problem with your phone, you want to know the functions, you want to know how to deal with all those things of technology and so on, go to a channel called it.next. It is being run by my man here behind the camera, Kesbag, say hi to people. So Kesbag is the man behind it.next. Go there on his channel, subscribe, and enjoy his videos. He's also a very good man. You'll be covered there with IT. And thank you so much for watching our live today. We are saying bye-bye to you. Those of you that have not answered questions today, I'll answer them next time. Please come back next week, Thursday, same time. We shall be having this live. It starts at exactly 7 p.m. all 19 hours East African time. We shall cover you. Thank you so much. God bless you. Sign out.